Ever wondered why some couples struggle to conceive? Today we're shedding light on a topic that perhaps doesn't receive enough attention: infertility. Affecting millions worldwide, it's a complex issue with many underlying causes. We're going to take a closer look at male infertility, female infertility, and the evaluation process for couples. We'll explore the causes, the diagnostic tests, the treatment options, and the assisted reproductive technologies that are providing new hope for many. So are you ready? Let's dive in to unravel the mystery behind infertility. What if I told you that men contribute to infertility as much as women do? Indeed, when it comes to creating life, it takes two to tango. And in this dance, male infertility is just as common as its female counterpart. So, what exactly is male infertility? It's a health issue in men that lowers the chances of his female partner getting pregnant. It usually hinges on the quality and quantity of a man's sperm. Now you might be wondering, what causes male infertility? Well, several factors come into play. Hormonal imbalances, for one, can affect sperm production and function. This could be due to conditions like hypogonadism or issues with the pituitary gland. Then there are structural problems. These include blockages in the tubes that carry sperm, which can be caused by various conditions like a varicocele, which is an enlargement of the veins in the scrotum. And let's not forget lifestyle factors. Things like smoking, heavy alcohol use, drug use, and even obesity can negatively impact sperm count and quality. Even excessive stress can play a role in male infertility. But it's not all doom and gloom. There are diagnostic tests available that can help identify the cause of infertility. These range from semen analysis, which evaluates the health and viability of sperm, to hormone testing, which can detect imbalances that might be affecting fertility. Once the cause is identified, there are several treatment options available. These can range from medications and surgeries to lifestyle changes and counseling, and these are not just aimed at increasing the chances of conception but also improving overall health. In some cases, assisted reproductive technologies, or ART, may be recommended. These are procedures that help sperm get closer to the egg, boost fertilization, and increase the chances of pregnancy. Some examples include intrauterine insemination and in vitro fertilization. But men aren't the only ones dealing with infertility. Let's switch gears and talk about female infertility. Did you know that problems with ovulation account for most cases of female infertility? It's an often overlooked fact, but one that is crucial in understanding the challenges many women face when trying to conceive. Female infertility can be a perplexing issue. In essence, it refers to a woman's inability to conceive after a year of regular unprotected intercourse, or the inability to carry pregnancies to a live birth. It's a complex problem with a myriad of potential causes. One of the most common causes are ovulation disorders. These disorders, which affect the release of eggs from the ovaries, can be due to hormonal imbalances like polycystic ovary syndrome, or PCOS, which is a common hormonal disorder among women of reproductive age. Other conditions, such as primary ovarian insufficiency, can also lead to ovulation problems. Structural issues are another significant cause of female infertility. Conditions like blocked fallopian tubes, often caused by pelvic inflammatory disease or uterine abnormalities, can prevent the egg from being fertilized or the fertilized egg from implanting in the uterus. Age-related factors also play a role. As women age, their fertility naturally tends to decrease. This is typically due to a lower number and quality of eggs, and can also be due to health problems that affect fertility. Diagnosing female infertility usually involves a series of tests to evaluate the woman's reproductive system. These tests might include hormonal tests, imaging tests like ultrasound, and sometimes minor surgical procedures. Once the underlying cause is identified, treatment options can be explored. These could range from medication to regulate or induce ovulation, to surgery to treat endometriosis, fibroids, or other structural issues. In some cases, assisted reproductive technologies, or ART, may be considered. This includes procedures like in vitro fertilization, in which eggs are fertilized by sperm in a lab, then implanted in the uterus. As you can see, both men and women can face infertility issues, but what happens when they are evaluated as a couple? It's a question that leads us to the next part of our discussion, the comprehensive evaluation of couples. Did you know that in some cases both partners in a couple can contribute to infertility? Yes, you heard right. Infertility isn't always about one person. Sometimes it's a complex dance between two partners where each plays a role. This is where couples evaluation comes in. It's an intricate process, one that goes beyond the individual and looks at the couple as a whole. It's not just about finding out who's responsible, but about understanding the unique dynamics at play. Let's break it down a bit. A comprehensive couples evaluation often starts with in-depth interviews and medical histories from both partners. The aim? To identify any possible factors that could be contributing to infertility. This could include anything from lifestyle factors like diet and exercise to medical conditions or even emotional stressors. But it doesn't stop there. The evaluation also includes a series of tests that can help to pinpoint any combined factors. For instance, a couple may both have minor issues that alone wouldn't necessarily lead to infertility, but together, they could create a significant hurdle. Now you might be thinking, that sounds intense. And yes, it can be. But there's a silver lining. This comprehensive approach allows for a more targeted, effective treatment plan. Instead of focusing on one partner, healthcare providers can address the issues on both sides, improving the chances of successful conception. And this is where the beauty of collaborative approaches to treatment comes in. Working as a team, both partners participate actively in the process, supporting each other every step of the way. They share the responsibility, the challenges, and ultimately, the success. And let's not forget, this journey also opens up opportunities for couples to strengthen their bond. It's about communication, understanding, and empathy. It's about facing adversity together and coming out stronger on the other side. So, if you're on this journey, remember this: you're not alone. There's a whole community out there, ready to offer support, advice, and understanding. Remember, infertility is a journey that doesn't need to be walked alone. So we've learned a lot today about infertility, haven't we? We've explored the causes, the diagnostic tests, and the various treatment options for both men and women. We've also delved into assisted reproductive technologies, or ART, and how they can help in overcoming infertility. Moreover, we've emphasized the importance of a comprehensive assessment for couples to identify combined factors and develop a collaborative approach to treatment. Infertility is a complex issue, but with understanding and the right approach, it's a challenge that many can overcome.